Hi, everybody. Now that all of our guests are on, it's time to start the show. So, hi there. Welcome to UHMP Therapy Thursdays. These are our lovely panelists. Today's topic is opioid addiction and overdose. There's so much to say on this conversation. There are so many things we could discuss. So many sort of nuances and complex misconceptions about it. So it's going to be a really great conversation. I'm really excited. So I'm just going to go ahead and introduce myself first off. My name is Adrienne Gibbons. I use he, him pronouns. I am a UHMP staff member. I'm on the content and programs team. I do video editing. I do social media and other operations things. This is my first time moderating a Therapy Thursday, so bear with me, guys. But that's me. And now we can introduce our wonderful guests. This is Paul Moore, Orlando Howard, and Lisa Fair. So, Paul, would you like to start? Introduce yourself.
Hi, I'm Paul Moore. I'm a certified peer recovery specialist. My latest endeavor has been working on opening a sober living center in New Hampshire, and I've been in recovery for probably about 30 years, but I have about over 3 years sustained sobriety off of everything, and opiates were a big part of my story. So that's me.
Congratulations on your sobriety.
Thank you.
Orlando, would you like to introduce yourself?
Sure. Thank you for having me today. My name is Orlando Howard. I am not anonymous. I'm also a person in long-term recovery. I've been in the field of substance use disorder and mental health since 2002. So I've been doing this for about 29 years. I'm a licensed chemical dependency counselor. I'm also an internationally certified alcohol and drug addiction counselor. I'm a substance abuse professional, and I'm also an Ohio recovery peer supporter with the supervisory status. I've been in the field for 29 years, but my sobriety date is August 1st of 2002. So I had 10 years of sobriety, and then I relapsed after 10 years, and that was 19 years ago. That relapse lasted 3 days, but I have abstained from all mood and mind altering chemicals for the last 19 years. So thank you once again for having me.
You're very welcome. Glad to have you on. Lisa, would you like to introduce yourself? Oh, she just left. Let me try and see if I can add her back in. Just 1 minute.
Stay tuned for technical difficulties.
Like those little 5, 4, 3 screens. I invited her. It appears as though she's dropped out of the call. Okay.
No worries, Adrienne. You're doing a great job.
Thank you. You know, we could start our questions and get back to her when she rejoins. Every time somebody comes into the stream, it pops up, so I'll be able to see it and add her back in whenever she comes back.
Oh, will do.
Never mind. She just requested, unable to join. What? So sorry, y'all.
No problem.
Okie dokie. All right. You know what? All right. It's okay. We can just start. I don't want to waste your guys' time. Okay. So I think the first question that would be good to ask is, what do you wish people knew about opioid addiction? And like, what has been the most surprising thing to know about your work in this area, addiction and opioid use.
Okay. Who you want to start with?
Just well, mainly, what do you personally wish that people knew about addiction? Any sort of myths that need to be debunked?
Okay, well, I'll go ahead and start, Paul, if you
Go
don't mind.
Okay.
I'll go ahead and start. Well, you know, the first thing that I wish people knew about opioid addiction is probably one of the biggest things is that it is a disease. And a lot of people don't understand opioid addiction. A lot of people don't understand addiction or substance use disorder. They don't believe that it's a disease. Some people believe that it's a matter of willpower, that you should pull yourselves up by the bootstraps and, you know, be able to drink or use drugs, you know, sociably. You know, back in the 80s, you know, when cocaine came around and people were snorting cocaine, you know, it was a very sociable thing to do. I even did it back in the 80s, but I had no idea it was going to lead me to other drugs. So, you know, opioid addiction is a disease, and that's what people need to know. You know, I think a lot of folks aren't educated about the disease concept or the disease model, but it is absolutely a disease. And the best thing about it is it's a treatable disease. The second thing is that it's not a choice. You know, a lot of people believe that opioid addiction is a choice, and it's not. For some individuals, you know, there's a saying where most people would say there's a soft drug and a hard drug. There is no difference between alcohol and heroin. A drug is a drug is a drug. It all gets you to the same place. One is just like taking Lolly to Trolley, and the other is like taking the bullet train in China. You know, you just get there a lot quicker. So it's not a choice. It's an addiction. And when people are hooked, you know, I've heard people once say, you know, it's like having a monkey on your back. No, with opioid addiction, it's like having a silverback gorilla on your back, not a monkey, silverback. So I just want more people to understand opioid addiction and understand that it's not a choice.
Yeah, it's very there's so much like stigma and stuff around addiction that it's very hard for people to sort of separate that from how it really is. And like it's hard for people who don't understand or have experience with it to be able to empathize with people in that situation. And it's very difficult. Paul, what do you think? What do you wish people knew about?
I agree with Ando wholeheartedly, and I agree with the disease model of addiction. And, you know, I have some, you mentioned some people think about weak-willed and selfish and stuff to describe those who are addicted. And in my, you know,
Can you guys hear me?
Yes. Thank you for joining.
I am so sorry. I apologize profusely. Okay.
Absolutely no worries.
Let's carry on.
Go ahead.
All right.
Orlando. Paul.
Okay. Welcome, by the way. And yeah, in my
sound went back off.
some family members who would say that on a regular basis. Well, you're weak-willed, you're selfish, and so forth. And they have a hard time relating to what addiction was like. So they could have one year, or they could have, you know, they smoked legal marijuana, and they were okay. And function.
My sound went back off.
Go into their addiction.
I don't know what's going on.
The analogy I came up with for that was to tell.
I had it when Brandon was there. This is very disturbing to me.
Fasting.
Mommy, call Brandon for me, please.
We can hear you. Lisa, we can hear you.
Okay, it seems like
I can't. This is ridiculous.
Oh boy.
Oh, this is so disappointing.
Stay tuned for technical difficulties. Sorry you're having so much trouble, Lisa. The analogy I gave them was to try to fast for a few days and then see what you would be willing to do for a piece of food. You know, and even in that scenario, it's not the same as addiction, because once you have some food, you're satisfied. You know, you have a little bit of bread, you have something to eat, and your hunger is satisfied. With addiction, It's like that constant craving, and there is no satisfaction once you have it. And it's very short-lived.
We can't hear you, Adrian.
Whoops, my apologies. I muted
There you
myself.
go.
Yeah, those are very good points. I'm wondering, like, what do you guys think is the reason for all that stigma? Do you think that there's what do you think the roots are of that?
Well, I think the roots of stigma is a few things. The first one is lack of education. There's so many people that are uneducated about addiction and they don't understand it. When we look at stigma, it's not just about opioid use disorder. There's stigma around sexuality. There's stigma around race. There's stigma around where you live, where you were born. Stigma is always been out there, but when it comes to opioid addiction, it's a lack of understanding. For instance, if someone has diabetes, the doctor's going to tell you everything you need to know about being a diabetic. And you don't see people turning their nose up to people who have diabetes, because most of the people, if the doctor tells you, you're in early stages of being a diabetic, I have to go next week and get my A1C done because 6 months ago, the doctor told me I was on the borderline. And he told me to change a few things about my lifestyle and my habits and what I eat and come back in 6 months and he's going to check to see. Well, I want to know everything there is to know about diabetes. I want to know every single thing. So I'm going to listen to my doctor. I'm going to read up on everything that I can read up on. And I'm going to educate myself. I may even, listen to my doctor and let others educate me. But when it comes to opioid use addiction, a lot of people, they've already formed an opinion in their mind, that it's a bad thing. And that's not true. So the stigma associated with opioid addiction is a lack of education.
Mm-hmm. I definitely agree with that.
Look at myself.
Sorry.
Thank you. I
Oh,
think
go ahead.
I'm going to paraphrase here because I don't have these quotes memorized. But I think Carl Jung said, "Thinking is difficult, and therefore most people judge." And I think until for me personally, I needed to accept it myself, and be comfortable. I never really had a problem with going to or AA, and I myself as an alcoholic. There is a lot of stigma, but those were the first places that I fully accepted as who I was. So, if people wanted to still label me with that, I think you know, I don't know, it's general and it's lack of understanding, like Orlando comment. I think that more education helps. My writing, I put a lot of stuff on blogs and social media about exactly more about my recovery than about my addiction. And so many people, not as many addicts, but people with addiction within their families, reached out and they were very thankful because they had thought their children or their spouses or anyone that was in their life significant didn't love them. It wasn't about that for me. Like, this is the only thing that makes me happy. I'm willing to compromise some values to get that. And once it's in phase in your brain, there's no telling, exactly what I'll do to continue my drug use. Usually it took power greater than myself to stop it. Whether that power was uh, uh, the police, putting cuffs on me, or some family member, or me running out of money, or me being so physically sick that I could not even go and score more dope. So it always something once that session. to actually physically harm me from it. That's why, I think rehabilitation centers, recovery, clinical support, and education.
Well, thank you very much for that. Lisa, I'm not sure if you heard the initial question.
Yes. You guys have to excuse me. I'm having so many difficulties. Yes, I'll be glad to answer a question. I'd like to.
Absolutely no problem.
Go on.
So we were discussing why we personally believe there is so much stigma around addiction, and particularly opioid addiction. Do you have any
Yes.
thoughts on that?
Yes, I do. Well, for one thing, the way the epidemic started, I think, really attributed to how people are looking at it now, because when it first hit in in the late 2000s or whatever, in the late 1900s, it was a lot of Caucasian people, and a lot of the kids that got originally addicted were bright kids who had sports injuries, and then of course they went on to heroin. Our society really isn't really kind to people that they don't think is keeping up. So once people start to use opioids, of course, they slow down, they drop out, and it's just terrible that we don't look at addiction as a disease instead of a moral failure. So, like I said, most of the time when people use opioids, they don't have the drive to go to work and do things that society expects us to do. So therefore they kind of drop out and they become people that we discard in this society. So I think we're getting better with stigma and bias as far as opioids are concerned, but we have a long way to go. My office in particular does a lot towards harm reduction and opioid addiction. And I've put a lot of those things up on my page, so I hope everybody takes advantage and looks at those things. I worked really closely with Orlando at one point, and he was doing really good work with people who had opioid addictions and getting them detoxed and getting them into treatment and following their success. So that's basically what I try to do. But like I said, we have a long ways to go with stigma and opioids.
What do you think in the future we can do in order to particularly to not only sort of treat individuals with opioid addiction, but the sort of epidemic as a whole?
Well, the first thing I think that we need to do is start meeting people on where they are. Like, take, for instance, a lot of people who use opioids present in emergency rooms. So I think we need to train more professionals to interact with these people like it is a disease. So many people do have a lot of different ideas about heroin addicts or people who use opioids, and they don't really treat them humanely. So that's one of the things I think we need to do is point people where people present. Like I said, in emergency rooms, when people overdose, we have a quick response team in our office that goes to people's houses once an overdose is reported to see if they like to engage in some type of help, medication-assisted treatment, for instance, intensive outpatient treatment. We just started a new clinic, a walk-in clinic, where people can come that have opiate use disorder. That's a lot of the ways I think that we deal with it now is we just like put it behind us and think it's going to go away. But then, of course, it keeps presenting until maybe someone dies, which is a catastrophe. What was your other question? You said, how can we prevent it?
Yeah, I mean, if you'd like to answer that, go for it.
Okay. Well, harm reduction is a big component in helping people get to sobriety. So, like I said, we have to meet them where they are. So if people are using, we want to make sure that they're safe while they're using so they can live another day to conquer this disease. So For instance, if someone has opioid addiction and they use heroin and they use it IV, they need to use clean syringes because, of course, the chance of them getting hepatitis C or HIV is very big if they're sharing needles or any other equipment with someone else that's using syringes. So harm reduction, offering them clean needles, clean surfaces, water to rinse their syringes, cotton balls, all those types of things, for one thing. Another thing is to encourage people to go to treatment and not put people in jail. My job requires me to go to the county jail to interact with people while they're there. And then, of course, I still see them when they post-release, when they're released. But a lot of my clients are in jail and they really need to be in treatment. So, like I said, we're going to have to look at this in a whole nother way in our society. It is a disease, and we're going to have to take that approach.
100%, definitely. Paul and Orlando, what do you guys, what do you think about that?
I'll pipe in a little bit on that, especially the, what I've seen a lot of times. It's really sad. I work in, this is a professional field. We're getting paid by health insurance because, we're trying to treat addicts. I see a lot of judgment within a lot of people that work in the field. And then I've seen some things that I think are actually. I was on MA for over 10 years. And when I just, I had a lot of problems with it. My degree is in fine arts. I'm an artist, I'm a musician, and from the personal experience of MAT clinics and so forth, I haven't seen much therapy provided with it, much encouragement toward recovery provided with it. And, personally, when I tried to get off, I had every doctor, oh no, don't do it. You're going to go back to the opiates. And the problem was I was doing other things while I was on it because I didn't do artwork anymore. I didn't play music out anymore. I became very depressed, zombie-like, and and then I started using other things that would still get me high while I was on it, like cocaine, and I had cocaine. Brought that back into the loop and down pretty quick. And just to have a doctor that says, okay, well, you want to try getting off of this, monitor you very closely, and too difficult, and you look like you're going to relapse, we'll put you back on for a while and provide some extra therapy, provide some extra recovery support, and so forth. But I haven't seen that happening very much because it's easy money for a doctor to do a 5-minute consult a month and bill the insurance to keep someone on it. I think that is, I think it's kind of difficult to stomach a little bit, to be honest.
Yeah, definitely supporting the people that are in need of treatment instead of just turning them away, and being able to view people that use as people with a disease rather than a moral flaw or a moral failing. And especially in the medical field, when it comes to like doctors and things, they need to have empathy towards everybody, and that's not the case all the time. So sorry to cut off whatever discussion this was, but I do need to, I would like to ask another question of you all. Since August 31st is national, I believe, national, not international, Overdose Awareness Day, we're doing this live stream to raise awareness about addiction and overdose. So one of my last questions is going to be, what can somebody do if they're witnessing an overdose or or something close to one? What can people do? Orlando, would you like to start?
Sure, absolutely. Thank you. The first thing is call 911. The second thing is to understand what an overdose looks like.
Yes, absolutely.
It's not really just, you know, it looks kind of like someone who's intoxicated that you can't awake. It can't be awakened. But one thing to know with an overdose, how do you really know? You give somebody a sternum rub with your knuckles right in the center of their chest. And if you push pretty hard, it really hurts really bad when you're awake. And it will actually wake you up if you're not in an overdose. But if you have overdose, that won't arouse you. So knowing the signs of overdose is important. Calling 911 is the first thing you do because a lot of people don't know if the person has overdosed or not. They may think they just passed out. So it's important to call 911. It's better to be safe than sorry. Also, I carry Narcan, also known as Naloxone. I carry it with me just in case, you know, I encounter someone that has had an overdose. I am prepared to revive that individual. So I encourage everyone who knows someone who uses opiates or they live with someone that uses opiates, and that could be not just heroin, it could be oxycodone, oxycontin, Vicodin, Percocets. It can be, you know, it comes in many different forms, but it all takes you to the same place if it's misused. So if you live with someone or you know someone, it's important that you have Narcan. You know, and I'm sure they're like your local Adams boards, alcohol, drug addiction, mental health services boards. They can give you information on where you can go and get Narcan for free. So it's important to know the signs and symptoms of an overdose, to call 911, and get the person help as soon as possible because time is of the essence. You don't want to wait.
Absolutely. Thank you for
May I
letting us
add
know
something to that?
how
Sorry.
and where to get Narcan. Because I definitely have heard a lot about that and making sure that people who are living, especially if you live in an area where there are a lot of overdoses or people that use drugs, it is a very good thing to do to carry Narcan around. Lisa or Paul, do you have anything to add to this?
I did.
I do. Yes, I do. Can you hear me?
Yes.
Yes, we hear you.
Okay. Great. Orlando is right about getting a kit. The Office of Opioid Safety disperses kits around the city. I added that sheet to my page. It's called Project Dawn, which stands for deaths avoided with naloxone.
Mm-hmm.
And we train people and issue those kits every day. We have an RV that's parked on West 25th, right across the street from the hospital, and we give out naloxone every day. It's a prescription, but we give it out. So anybody that needs a Narcan kit, and as Orlando said, everybody should have a kit, I think. Even if you don't know anybody that uses, you could be anywhere and experience an overdose. And it's amazing how fast it works and how easy it is to administer.
Mm-hmm.
So I think everyone needs a kit nowadays because I've had to use my naloxone kit many times and I never expected to have to use it. One of the weirdest places I used it was at a funeral of a person that had overdosed. And there were many people there that were using at the time. So that was really weird to me, but I've had to use my naloxone many places. Also, like I said, we do train people. So even if you have large groups of people that would like to be trained and obtain a kit, you can call our office. The number is on that flyer that I posted, and we'll be glad to arrange to have someone come out and train you.
That's amazing. Thank you very much, Lisa.
You're
So
welcome.
since we're almost at time, I just have one last question for you all. Well, it's more like two questions, but it's basically one question. Is there hope for people that choose to get help, and what resources are there?
Yeah, I'll start. Yes, there's hope. There's always hope as long as you're breathing. I'll say that again. There's always hope as long as they're breathing. And what we have been reduced to these days is just trying to keep people alive long enough to get them into detox or treatment. People who are addicted to opiates are not using anymore to get high. They're using not to be sick, not to go through withdrawals. And now we see people that are not using heroin anymore. They're looking strictly for fentanyl.
Mm-hmm.
And that's what they're looking for, because their tolerance for heroin has increased that now they can't get high off of it anymore. So as long as a person's breathing, there's hope. They can call 211. I believe that's the number for first call for help. Your local Adams board. Here in Cleveland, Ohio, that number is 216-241-3400. And Paul and myself have already admitted that we are a person in long-term recovery, and nobody gave up on us. And look at where we are today. So if people hadn't seen me crawling around on the carpet safari, those people who use crack know what I'm talking about. Crawling around on the floor looking for a piece of dope that somebody dropped, would never think that I would amount to be anything. But somebody believed in me. Some counselor, some case manager, a treatment center, a family member, they believed in me and they never gave up on me. So I'm really grateful that people never gave up on me, because now I have a chance to do something I have never done in my life. And I'll end by saying this. When the caterpillar thought life was over, it turned into a butterfly.
That's good.
That's incredibly beautiful. Thank you, Orlando.
Mm-hmm.
Do you, Paul or Lisa, have any final thoughts on this?
Yes, well, I'm sorry. Go on, Paul. You haven't said anything in a while. Go on.
Please.
Paul, are you there?
No, I defer to you, Lisa.
Oh, I'm sorry. I didn't hear you. Of course. I like to piggyback off of what Orlando just said. I think I made reference to this earlier. As long as people are alive, they have a chance. And so it's really important that we understand it may have been 6 times, 7 times, 8 times as they've been around, and then they come back around again. But maybe that 8th time is the time that they get it.
Yeah.
So I think it takes special people, and like Orlando said, most times people who have had some experience in addiction themselves are really effective with dealing with people. Not saying that people who don't have any issues with addiction don't do well, but it's really, really important that we don't lose our patience with people, and that we realize when maybe we're getting burned out and we need to take a step back and regroup and understand and know that we need to treat people with tenderness and kindness and with humanity, because these are still people. And just like Orlando said, people come back. We shouldn't give up on people. People come back and they exceed things far beyond our expectations. I don't know anyone that was growing up at 3 or 4 and said, when I grow up, I want to be a junkie, or I want to be a dope fiend, or I want to be, no one says that. I don't think that that's anybody's aspiration. And also, and of course, we don't refer to people with those names, but I'm saying, like if they're hearing someone talk about things like that, they may use that terminology. We never use that terminology. But then, just like Orlando said, once someone begins to use heroin or some other opiate, it's not affecting them. They're not having fun. A lot of people think that people are having fun after a while. They don't want to be dope sick, and it must be a very terrible feeling to wake up in the morning and know that if you don't get your medicine, you're going to feel like you're going to die. So that's an urgency that probably most people don't understand. And then to think that if you don't have money, what you might have to do to get the medicine. So I'm a firm believer in medication assisted treatment. I've seen it do some wonderful things for people. And Metro Health has different facilities. There's still Metro Health facilities that offer medication assisted treatment. And I know that medication assisted treatment is not effective if you don't add some type of intensive outpatient treatment or inpatient treatment. So the two of them work together. So we need to really work on making that more accessible in our community, letting people know about it, and of course, like I said, embracing this community of people. They're people too. And I'll
Again,
end on that note.
Thank
that
you,
was
Lee.
really wonderful. Paul, do you have any final thoughts before we sign off?
Yeah, I do. I believe, you know, I overdose. Give up on it. And people in the medical community had I had a lot of people that up. And the one thing that could cut through whatever I was on, you know, wasn't yet was disparaging. I did that every day. You know, there was nothing you could say to me that was worse than what I was saying to myself. The one thing that could cut through the drugs and the alcohol and whatnot was love. You know, when people approach
Yes.
that you're not the person you want to talk about. We want you back. We need you. I'm still saying that because, you know, when they approached me with that way, there was nothing that would you know, that I would try to get higher, kill that, and go away. And I had to look at where I was going. I'd say I have every night and a lot with newly recovery. You know, I'd say the best time now is that these dead eyes coming back to life, and I see life coming back. You know, the numbers of people that go back out and so on and so forth, the percentage is very high. Really live for the people that do. And even if the percentages are high, I believe every time a person gets into treatment, they get a little seed planted that stays with them. Goes, maybe I got to try. So it's been great with you all tonight, and hopefully open some minds on out there. I hopefully have more conversations with you all in the future. Thank you.
Thank you very much. This was a really amazing conversation. Thank you all very, very much for being here. We're unfortunately at time, so we have to sign off now. But next month's Therapy Thursday should be on September 30th. I believe it will be on back to school mental health, and should be featuring some students and people in the education system discussing that. So, yeah, I mean, that's all. Make sure to check out our YouTube channel for the full upload of this live stream. Will be on there, and in a couple of days or maybe less than a week, there should be a little edit of this live stream with all the most important parts. Cut out all the technical problems. So it's with love, Lisa.
Oh boy. Thank you, Adrian.
Thank you very much. Have an amazing
You all
night.
for contact list, please stay in contact if I can.
Yes,
Yes.
I will be sharing that with you all after the sessions.
Great.
Well, thank you. I enjoyed it. Thank you. Good night,
you.
everyone.
Thank you.
Good night,
Good night, all.
Adrian. Good night, Lisa. Good night.